So we focus on laser gum treatment for a lot of our periodontal infections. It's different than traditional scalpel and surgery. When I'm treating someone with gum disease and I'm using a scalpel, I make an incision in the gums and I pull the gums away from the teeth and the bone and I clean out the infection. And then when I'm done, I may or may not graft, and then I would suture the gums back into place. That's been the same treatment, the same process in the treatment that's been provided since 1945. A doctor named Saul Sluger developed the first osseous surgery technique and published it in 1945. But the problem with that approach is it leads to gum recession, and your teeth can be more sensitive as well. So today we offer a procedure called laser regeneration and laser new attachment. Two different procedures that we complete with a laser. And basically what it is it means I don't have to use a scalpel. So what that means for you is I'm doing a microsurgical procedure. I'm wearing high-powered loops when I'm doing the procedure. I can still clean out the infection around your teeth, but when I'm done, one, I didn't have to use a scalpel to get started, and two, when I'm finished, I don't have to use sutures. What that means to you is less swelling, less bleeding, if any, at the end of procedure, and the recovery is much faster. And more than anything, I think for most patients, is down the road when you smile, your teeth don't look longer as a result. So doing a laser gum procedure versus a scalpel procedure has a really significant impact on you long-term, way past when the treatment is finished. Another aspect of laser regeneration is today we use growth factors to grow back the bone and the gum back around your teeth. So it turns out that growth factors don't turn into bone, but they're actually proteins that stimulate your bone to grow. It's like using a fertilizer on your bone. So say that you've had gum disease, your teeth may be a little loose, and this bacteria has been growing down the surface of your roots, and as it grows down the surface of your roots, it's causing bone loss around your teeth. So it's like having a castle with a moat going around it. So when I'm treating that, I use the laser to clean up the infection, to empty out the moat. And then when I'm finished, I use these products to stimulate your bone to grow back where you've lost it. So we can regenerate your bone using growth factors today. Just a huge advance over anything that we could do in the past.